All right. Good morning, everybody, and welcome to our Community Responds. I am Eileen Ellsworth, the President and CEO of the Community Foundation for Northern Virginia. And this event this morning is for a very elite group of people today. You are all donors to our COVID-19 Response Fund for Northern Virginia. And I wanted to start this morning's event with just a great big thank you to all of you. We've never seen anything like the outpouring of generosity for this fund, but then again, there's never been anything quite like COVID-19 in anyone's living memory. Donations to date to the fund are over $1.7 million, all private philanthropic gifts made by concerned companies and individuals and foundations across Northern Virginia, across our region, who just want to help, and the donations continue to pour in. In the past 3 weeks, we've awarded 2 rounds of grants totaling $460,000, and we are about to award our round 3 grants next week. We're thinking it's going to be another substantial round between $350,000 and $400,000. We'll go back out the door to nonprofits that are focusing on providing just basic routine healthcare, mental health care, and dental health care for our low-income, uninsured and underinsured residents, as well as organizations that are offering services to victims of domestic violence, which is soaring under the stay-at-home orders across our region. All of your contributions are being invested back into this community, and they're being used to help our most vulnerable neighbors get through the economic and social fallout of the pandemic. And today we thought it would be a nice idea if we shared some of the stories that we've gleaned and we've heard from some of our round 1 and round 2 grantees. These are stories of the impact of the fund, of your donations to the fund. So now I'd like to introduce Megan Niewold, our Director of Development, and Josiah Day, our Director of Donor Relations, who are going to share these stories with you.
Thanks, Eileen. Good morning, everybody. First, I'd just like to echo Eileen and say thank you so much for all that you've done so far. But most of all, really thank you for your desire to give back. We are so appreciative, and these nonprofits that we're helping, they really need it. So thank you. I want to give you a quick overview of the format this morning. We asked our very busy nonprofit partners for a way to communicate their stories to you. Some of these stories are in video format from the nonprofits, some are passed along, and some are letters from executive directors. We hope that you find this session to be informative and inspiring, just as we do. While this is a thank you, we have muted everybody, but if you have any comments afterwards, feel free to email us. Our emails will be on the very last screen. So now, to date, just some numbers to refresh everyone's memory. Like Eileen said, we've raised over $1.6 million from individuals and companies and foundations. So far, we've given out $460,000 in grants. And by next Friday, a week from today, we'll be giving out another substantial amount, making our grant total upwards of $810,000 back into the community. This really would not be possible without donors like you. So thank you so much. Now, I'd like to give the Zoom microphone to Josiah, our Director of Donor Relations, as we officially kick off this morning's presentation.
Thanks, Megan. So the first nonprofit that we'll be highlighting with a couple stories and statistics is Loudoun Hunger Relief, who serves those that are food insecure in Loudoun. And they primarily support children, senior citizens, the working poor, the ill or disabled, as well as the homeless. And so we granted Loudoun Hunger Relief $20,000 in our first round of grants to help them meet the massively increased demand for their services. Since March 7th, the unemployment rate in Loudoun County has risen from under 2% to more than 6%. And Megan will talk to you a little bit more about that.
Many families that are already living paycheck to paycheck in Loudoun County have lost their incomes. The ALICE numbers, ALICE, Asset Limited, Income Constrained, Employed, indicate that roughly 28,000 Loudoun households were already at subsidized income levels. First-time client visits to Loudoun Hunger Relief have increased from about 10 per week to an average of 16 per day. Loudoun Hunger Relief has had an increase in demand for services of about 50% so far in this crisis. Thanks to your help, they're keeping food in stock and packed for distribution to those in need. With these additional emergency financial resources, they are not only keeping pace with the increased demand, they're exploring more ways to expand service to those who lack transportation to get to Loudoun hunger relief.
Yeah, and a surprising number of calls for help have actually come from people who know about Loudoun Hunger Relief's work from the donor perspective. So families who are used to having a little bit more than enough have had their finances absolutely toppled by COVID. We spoke to one mom who has 3 children, one with special needs. Her and her husband were both laid off. And a year ago, they were donors to Loudoun Hunger Relief. A month ago, they were doing well with stable incomes and a little bit of savings. And yesterday, Loudoun Hunger Relief supplied them with food and referrals to other resources to help them get through this and stay housed. So as you've seen with the landscape of our community just changing so quickly for the families in our region, your support has allowed impactful organizations like Loudoun Hunger Relief to adjust to meet the exponentially increased need that they're now facing.
Our next nonprofit is Shelter House. We'd like to share with you a video from their executive director. Shelter House is a community-based nonprofit organization that provides crisis intervention, safe housing, and supportive services to homeless families and victims of domestic violence in our community. Shelter House received a $10,000 grant from our Round 2 grant cycle. We'll go ahead and play the video.
Hi, my name is Joe Meyer. I'm the Executive Director and CEO for Shelter House here in Northern Virginia, providing homeless services to families who are experiencing homelessness and victims of domestic violence. I really, truly want to thank the Community Foundation for Northern Virginia for stepping up during this critical time, and
I apologize.
thank you, all the donors who contributed to the COVID-19 response fund for Northern Virginia. We've been able to continue our services, continue to respond to domestic violence, sexual assault, and family homelessness during this crisis. We've moved several families out of our shelter even more quickly with these funds in order to make sure that we're taking care of the high-risk population, creating social distancing within our facility. It is critical that we keep doing that to lowering this curve. And I just want to say that the Community Foundation for Northern Virginia and all the donors that contributed to this fund has really proven to be extremely critical. So thank you all so much for everything that you're doing, for stepping up so quickly, getting the funds out so quickly. We truly cannot do this alone. It's a community partnership, and that's what the Community Foundation for Northern Virginia has really done for us. So on behalf of the families we serve, on behalf of the people that are coming into our shelters, requesting shelter, requesting housing, thank you all for doing your part in making this a safer place for us and for allowing Shelter House to continue our services. Thank you.
And so we'll move on next to Food for Others, which is a nonprofit that provides free emergency grocery services across the entire region. And Food for Others received a $20,000 Round 1 grant from our COVID-19 response fund for Northern Virginia. So Food for Others is currently serving up to 4 times as many people at their warehouse. And so that's an increase from about 60 families per day to over 240 families in one day. They're still also serving as a food bank to other nonprofits in this area, and they're operating an off-site pop-up pantry in Annandale. And all of this is occurring at the same time as a sharp drop-off in food donations from grocery stores and food drives. So that has forced Food for Others to purchase a lot more of the food that they give out, which is why the Community Foundation's donations have been a true lifeline for them.
As an example of this work, a mother who had worked as a master technician for the same company for 23 years was let go. Because of the nature of her job with the COVID-19 shutdowns, her client base had dried up, and in March, she lost her job. Her husband had an injury and was given reduced hours and reduced pay because he could not do the job that he had held for over 15 years. The parents have been able to purchase a home when they were both working, and now they fear they cannot make payments on their home. Additionally, in-laws with 3 teenage children moved in with them because their family lost their jobs to the shutdowns. With a grandparent and 5 extra mouths to feed, there are now 9 people in their home and income is limited. The family has had to choose to pay for food or for their mortgage and utility payments. When the mother called the school for help with groceries, she had never before asked for help. She was thrilled to find out about Food for Others, and having the emergency food helped her get through March. Through special outreach, she's able to access food in April as well.
Yeah, due to these unprecedented circumstances, people like in the family above have just never experienced financial instability, and they're experiencing severe challenges right now to make ends meet. Organizations like Food for Others allow families and individuals to worry about one less thing in their incredibly challenging situations, and your generosity has made that happen. So Fairfax Diapers is another nonprofit organization that we've supported through our COVID-19 response fund. They were established in June of 2019. They meet the needs of those who are diaper insecure and raise awareness for the need of diapers in Fairfax County. They received a $5,000 grant from a round 2 grant cycle. For today's event, their executive director would like us to read a statement to you.
Since our founding last year, I have been humbled and awed by the generosity and support that we have received from the Fairfax community. We distribute most of our diapers to clients receiving food at Food for Others, with over 13,900 diapers distributed in just March. We work with 2 additional partners. One of those partners is the Visiting Nurse Program in the Fairfax County Health Department. These nurses visit up to 300 at-risk clients each quarter, providing critical support to new moms and their babies. We at Fairfax Diapers have committed to providing these nurses a supply of diapers to bring with them on visits, as diapers are a much needed and much requested item. Here's a story from one of our nurses.
My 14-year-old client has a 5-month-old baby. Her mother, also a single mom, supports her, her older sister, and the baby. She makes $240 a week, and diapers are a huge expense. When the Fairfax Diapers so kindly donates diapers, my client and her mother are so happy because that means they're able to buy meat, papayas, and a few mangoes instead of spending their money on diapers. Thank you for helping our very vulnerable moms. And that comes from Maria, who is a registered nurse and a nurse home visitor for Fairfax Diapers.
Fairfax Diapers relies on individual donations and community organized drives to maintain their supply of diapers. During this time, when community organizations such as schools, churches, and civic groups are no longer operating as usual, this grant from the Community Foundation of Northern Virginia will enable them to continue to purchase enough diapers to meet the increased need. Thank you so much for all of your kindness and generosity. The new parents appreciate it. Next, we have ACTS of Prince William County. ACTS of Prince William County was a first-round grantee of our COVID-19 response fund and received $20,000 for their programs addressing the needs of the elderly and low-income Prince William. Their Hunger Prevention Center has now expanded its hours of operation and grocery delivery service to the homebound elderly and disabled to meet the increased demand, even while capacity to meet that demand drops. They also offer emergency financial payments to avoid utility disconnections and have expanded their Senior Link program, which provides more than 1,200 client check-in wellness calls per month to the same elderly and disabled population. Here's an update from their CEO, Steve Liga.
Hello. On behalf of everyone that we serve in the Greater Prince William region, I want to thank you for donating to Northern Virginia Community Foundation's COVID-19 Relief Fund. If you've been to the grocery stores lately, you know how empty those shelves can be. Well, that means that those folks who would normally pick up a little extra while they're shopping to donate to us, or the grocery stores themselves who would donate their overstock, they can't do it. They simply don't have the resources. This means that hunger relief organizations like ours have to purchase food, and we have to purchase it in bulk from distributors in ways that we never have before. For example, just last week, we spent $1,000 on cornflakes. I never thought I would say that. $1,000 on cornflakes because we had no cereal. Something we've never had to do before. We would not be able to make purchases like that, no way, without donors like you. So thank you, and thank you on behalf of those kids who now have cornflakes.
And like you've seen with something as simple as cornflakes, organizations are lacking the capacity to give out items that they've never had issues getting in the past. And because of you, a family has the simple yet meaningful opportunity to provide their kids with normalcy in the form of breakfast cereal.
Hello.
Such a great organization. Next up, we have Infant Toddler Family Daycare. They work to connect families with professional early childhood educators who operate high-quality family child care services in their homes. Their program provides nurturing care and early childhood education to children in a family setting beginning at 6 weeks of age. Infant Toddler Family Daycare received $10,000 from our Round 2 grant cycle, and the following is a message directly from their executive director.
The funding from the Community Foundation for Northern Virginia has allowed us to continue our work to support our low-income, primarily immigrant family child care providers who come from about 28 different countries and speak about 15 different languages, as well as the families they serve. I'd like to tell you a little bit more about what we do. The essential work of the parents in our daycares is vast. The children coming to care have parents filling many roles during the coronavirus emergency. We have healthcare workers, including physicians, nurses, veterinarians, and therapists. We have journalists and other media representatives. We have parents that work for the Department of Justice who currently are focused on thwarting hoarding in the community, as well as price gouging of essential medical items. At least one of our parents drives for UPS. We also have parents in national security, engineers working on ventilators, architects trying to redesign spaces to limit infection, and parents working directly or indirectly with the United States military. We have teachers, scientists, and parents in public health research. For many children, both of their parents are filling these roles, and for them, our homes are open.
Now, we'd like to share a story from one of the parents, a Secret Service agent. Our son Carter is doing well. He has been going to Shadazi's house and having lots of fun with her, especially on these warm weather days. We have a lot of trust in Shadazi and know that she will communicate to us if there are any health concerns at all in her home. We are so thankful that she remains open during this time.
An Infant Toddler Family Daycare would really like to express their gratitude to the Community Foundation for Northern Virginia for allowing this essential service to continue operating as normal. And on a final note, I just wanted to say that all the things that you all have seen in these stories and statistics, it all points to one fact, that there's a massively increased amount of need across our region due to COVID-19. But through your generosity, you've played a critical role in meeting this demand for basic needs in the lives of our neighbors and in our community as a whole. And our work isn't done yet. Today, we'll be closing the applications for our third round of grants, specifically focused on providing mental health services to those in need. As we proceed with a rapid response model of grants, we will continue consulting with health professionals and local area leaders to ensure that your support is allocated to the most pressing issues in our community as quickly as possible. As you've seen, the need is exceptionally high, but you've given us the remarkable opportunity to address this need through your generosity. In a time where everyone is so focused on self-preservation, we want you to know that your investment in the lives of others has made an enormous difference. Thank you for responding to our community and for your generous support of the COVID-19 Response Fund for Northern Virginia.
Thank you.
All right. Well, Josiah and Megan, thank you so much for that presentation. As all of you heard, the need is great. We've been hearing an increase in demand at the local food banks of between 50% and 90%. Homeless shelters are now social distancing. People who have never visited a food bank before are experiencing something completely new, this dependence on greater community. And you heard Joe Meyer at Shelter House say it. He thanked the Community Foundation, but he also thanked you because he understands that we do nothing alone here at the Community Foundation. We are certainly doing nothing alone on the COVID-19 Response Fund for Northern Virginia. And as Josiah just alluded to, we are going to continue to keep in touch with our local public health officials, with our local elected officials, with our foundation peers, and with our donors, so that we keep our ear to the ground and understand how these needs are evolving. We're going to continue to make rapid response grants to those needs as they evolve, and we're going to continue to share what we learn with you. So take care, everyone. Stay well, stay safe. Thank you so much for connecting with the Community Foundation for Northern Virginia on this incredibly important endeavor. There is much more to come. Have a good day, everyone.
Thank you all.
Thank you, everyone.